Hi, my name is Sheila and today I'm going to perform a complete bed bath cleansing. So let's start. Hi, my name is Sheila and I'm your caregiver for today. How are you?
I'm doing well.
That's good. May I know your name so that I can address you properly?
You call me Johnny.
Oh, hi Janice. So Janice, I'm here to give you a complete bed bath. Is that okay?
Sure.
Thank you. But before we proceed, is there anything bothering you, feeling itchy, pain, or you're going to use the bedpan?
Nothing.
Alright, so I will go and wash my hand and I'll be right back.
Okay.
Okay, so I already washed my hand. And I gathered all the equipments that I needed. So first, we have the lotion here, the powder, deodorant, alcohol, a comb, and a gloves for optional in case we need it. And right here, I have the bath towel, a clean gown, a two-face towel. One is for cleaning and one is for rinsing. So, and I have two basin here, and one basin is for cleaning, and one, this is for rinsing, and I have a soap here, and this is the bedpan, optional if the patients need it. And I have the bed protector here so that the table won't get wet. So now let's start. First, we're gonna loosen the end part of the top sheet and assist the patient closer to the end near me. Are you comfortable now?
Yes.
Okay, good. So now, let's remove the gown. Since the patient don't have tubing, we just can remove it any size. And let's put it on top here. And then let's spread the bath towel folded crosswise under the patient's head, and she prepared with pillow. So we're going to wet the face towel in the basin and let's start cleaning the eyes. So this is wet. We're going to make a mitten here and start. So on cleaning the eyes, you start from the farther cantos of the eyes and repeat the procedure. So it's done cleaning. Let's going to rinse. The same manner when you clean earlier. So the eyes is done. So now we're going to the face. Let's put soap and let's start from the powder making a pattern of CSC. To the ears. And same to the other side, to the nearer side. Let's also put soap. And now it's clean, let's gonna rinse. So the nearer side, down to the ear, and it's done. So now, after rinsing, we're going to pat it to dry. So now we're going to the neck. So now we're done on the face. Now let's go to the neck. So now I'm going to get the towel, make a mitten, and apply soap and clean the neck from farther side to the nearer side with a small firm stroke. Repeat the procedure. So now, let's rinse. Okay, so after rinsing, let's pat it dry. So now let's go to the arm and hand. So Janice, I'm going to remove the towel. Thank you. Okay. Now, let's soak the hands. So now let's soak the hand for a few minutes to loosen the dirt and the debris from the hand, and put some soap after that. So I got the okay, so it's done. So pay attention to the in between fingers here. So now let's do the arm. Stroke it firmly up to the arms. And repeat the procedure. Apply soap again. Up to the shoulder. Stroke firmly. Now let's rinse. So now, after rinsing, let's pat it dry. So after rinsing and pat to dry the arms, let's proceed to axilla. So let's expose the axilla. And I'm going to get the mitten. Rub some soap and stroke it from top going downward. Repeat the procedure. So now let's rinse. So now, pat it to dry, and let's proceed to the nearest arm. Let's soak the hands, the same procedure from the farther side. Apply soap and pay attention to the in-between fingers. And now we're going to rinse it. So now, let's do the arms, the near arm, sorry. And let's put soap on the mitten and do the same procedure from the farther side earlier, from the wrist up to the shoulder from the top using a long firm stroke. The side and the back here. And do it the same procedure. Put soap and do the same stroke again. Top, side, here. And after rinsing, let's pat it dry. So now, after pat to dry, let's proceed to the axilla on the nearer side. So let's expose the axilla on the nearer side. So I'm going to get the mitten and rub it with soap and clean it the same manners from the farther axilla. Rub it from the top going downwards. So repeat the procedure. Rub it with soap. And stroke it downward. Okay, so let's rinse. So this is the mitten. Downwards. Okay, it's done. So let's pat it dry, and the axilla is done. Okay, all right. So now let's proceed to the chest and abdomen. So let's put this towel crosswise. Janice, can you hold this part here? Sure. On the farther side. And I'm going to hold this and I'm going to lower this. So now I'm going to get the towel and make a mitten. And rub it with soap. And start from the farther side, from the bottom upward down to the abdomen. Make sure on the breast, underneath the breast, you have to rub it firmly to avoid sores or infection. Repeat the procedure. Rub it with soap. Start from the bottom, up, down, in a circular motion, down to the abdomen. And do it to the same on the nearer side. From the bottom, up, underneath the breast, and down to the abdomen. And repeat the procedure. So now let's rinse. The same motion as we did earlier, in the circular motion down to the abdomen, and repeat the procedure. So now we're done. Now let's pat it dry. Now, Janice, I'm gonna remove the towel. Okay, so now let's proceed to the back. So Janice, can you manage to lie on your side, facing away from me, exposing your back towards me? Thank you. So now let's spread the towel. Exposing the back. So now let's get the mitten. Rub it with soap. And rub it from the nape of the neck down to the buttocks in circular motion. Repeat the procedure. Rub it with soap. From the nape of the neck down to the buttocks in a circular motion. Now let's rinse. Repeat the procedure. The same manners. So we're done. Let's pat it dry. So Janice, it's done. You can go back to a supine position. So now let's do the lower extremities. So now let's expose the lower extremities and observe proper draping. Spread the towel. Flex the knee. So now, let's make a mitten and rub it with soap. And let's start from the ankle with a firm, smooth stroke up to the legs. And observe the inguinal area and the popliteal area. Repeat the procedure. Rub the soap and rub it from the ankle up to the leg in a long, smooth, firm stroke. And the inguinal area and the popliteal area. Now let's rinse. in the same manner from the ankle up to the knee, the side, to the back, the inguinal area, and the popliteal area. Do it the same manner. Ankle to the legs, knee, side, back, inguinal area, and the popliteal area. So let's pat it to dry. And let's do the other side, the nearer side. So let's expose the nearer lower extremities, flexing the leg. So let's do the same manners from the farther side. Mitten, rub with soap. Start from the ankle, rub it smooth and firm up to the leg. From here, knee, down to the side and the back, the popliteal area, and the inguinal, the popliteal area. Do it again with the soap. Ankle, the side to the leg, top, knee, upward, the side, the back, and the inguinal area, and the popliteal area. Let's rinse. The same manners from the knee, from the ankle up to the leg, front, the knee, the side, to the popliteal, and the back, the inguinal, and then the inguinal area and the popliteal area. One more rinse. Side. Inguinal and popliteal. Okay, we're almost done. So pat it dry, sorry. Pat it dry. So now let's proceed to the feet. So now let's flex the knee, both knees, and let's roll the sheets up. Place the feet under the towel.
Ikat lang ah.
So now let's soak the farther foot. Let's soak it for a minute or two, and then let's clean it. Make a mitten and soap it. Start cleaning the feet. And pay attention on the in-between toes. Make sure you remove all the dirt and the debris. So now, let's rinse. is the second rinsing. So now let's soak the nearer foot. Let's soak it for a minute or two. And let's start cleaning it. Make a mitten and rub it with soap and clean the feet. And the same manner from the farther foot. Pay attention on in between toes to remove all the dirt and the debris. And repeat procedure. Put soap. So now let's rinse. Repeat procedure. And now it's done, let's spot it dry. Okay, so we're done. So now, it finish it with a bath with perennial flushing, but that's different procedure. So now put on the new gown for or pajama, make the patient comfortable, and do aftercare of equipment and wash hand. Thank you.